Welcome to Distance is No Obstacle, the medical education podcast aimed at providing bite-sized education and information for people working in rural and remote Australia. Today we hear from the co-founders of the endometriosis healthcare app Matilda, physiotherapist Joanna and Dr. Kevin Wernli.
Hi, my name is Jo and I'm a pelvic health physio by background and one of the co-founders of Matilda. So I am a physio that treats specifically pelvic health conditions. So over time, I graduated with my master's degree in continence and women's health in 2018. And since then I have, before that, but also more so I suppose, I've treated pelvic pain predominantly. So that really piqued my interest, and I was lucky enough to fall into a clinic of specialists, so pelvic health specialists who are all physios. So there's lots of us here in Perth at the pelvic health clinic that all work together. And over time, my caseload has evolved really into pelvic pain, and more specifically than that, even endometriosis. So that, I suppose, is the marriage of my background in hospital physio, where we treat a lot of chronic disease management, to private practice, where we see kind of that ongoing endometriosis care, where it is that chronic disease marriage with pelvic pain.
I'm Kevin, I'm a physio, also a physio. That's how Jo and I met. I did a PhD in chronic low back pain and the influence of how movement and posture relates to low back pain. There's lots of myths about that, but also the influence of psychological factors and what really the recovery journey looks like. And I guess evolving from that, one of the frustrations about my career, I'm still in research, one of the frustrations about research is just the lack of translation that it has. You know, we publish in these academic journals, they sit behind a paywall, it's often written in complex academic jargon, and the person that we're trying to help, which is the person with the health condition, they're never going to read that, and it takes, on average, there's some data, 17 years to reach clinical practice from research. So that's not good enough for us. And was one of the driving forces of Matilda, I guess, as a way to increase the reach and the impact that we as clinicians can have to try and help that person. And one of the driving factors behind a number of initiatives we've been involved in, or I've been involved in, for example, podcasts and rural outreach tours and community events and those sorts of things that I've had the pleasure of doing all over WA and Australia.
So I suppose we could tell you a little bit about what endometriosis is and how Matilda was born. So endometriosis is a chronic inflammatory condition where tissue similar to the lining of the uterus is found in other parts of the body. So essentially, it's characterised by things like heavy and painful periods, bladder and bowel problems, pain with sex, infertility, pelvic pain or general pain, fatigue, bloating. You might have seen or heard of endobelly, where people get that really distended abdomen. And I would say things that are probably less common would be these intense bursts of pain. What else would I say would be less common? So we talk a bit about bladder and bowel dysfunction. That kind of often gets missed, so that constipation. And probably fatigue, probably the impact and the mental burden of endometriosis. We see that a lot in clinic, and the impacts that has on a person's lifestyle. So the people not being able to socialise, work, or have problems in their relationships and things like that. So what the development of Matilda, I suppose how that all began for Kev and I is, like Kev said, we've been friends for many years. We met at a physio practice and shared the same beliefs of how pain and chronic disease should be managed, of kind of that biopsychosocial approach, or looking at a whole person's life and a whole person's care. And so the frustrations we had were, I'd see someone with endo in my rooms, and part of that would even be the privilege that they've often got to physio, which seems so wrong to say out loud, that, they've managed to find the right physio who knows what endometriosis is. And often they'll have cycled through multiple health professionals or multiple allied health professionals to get there. And that felt frustrating, that's expensive, and they could have been spending their time more wisely. And also that limits their, I suppose, buy-in, so that kind of by the time they've got to us, there's a lot of doubt in that medical profession already, which is hard to kind of overcome. So that was part of the frustrations, is the access to good quality care, but also the frustrations around how expensive it is. So not to undervalue health professionals, we know how important their training is and how expensive that is. But if I was to say to someone, you've got endometriosis, not only should you see me, but you should see a dietitian, a psychologist, and a naturopath, just to list a few. That becomes very costly, which is really frustrating, because if you had things like diabetes or asthma, that would evolve and you would see, multiple clinicians, and there would be there's funding for that, and it's a bit cheaper and things like that. So that became very frustrating for Kev and I, that, that's that limitation of, if you're in your early 20s, you're feeling unsupported, people don't know what your condition is, and even beyond that, you then can't access the care that you need for something that's got a very high pain point.
Yeah, I think sort of summarising a lot of the frustrations from these, Joe and I and another pelvic health physio used to catch up for dinners, and a lot of the frustrations was we saw these, I guess, commonalities of the recovery journey and the different aspects of these care that would be helpful for people, but people just weren't accessing. So I guess rather than keep whinging at these dinner conversations, we decided to try and do something about it. We entered Perth Biodesign for Digital Health, which was kind of run through UWA, which is based off the Stanford Biodesign methodology, which is all about identifying a clinical unmet need, going deep on identifying what are the key problems here and what are the ones that we can try to solve. That was a 5-month program. We ended up winning that, and after that we thought, okay, maybe there's something in here. So that was last year, and we started a company as a result of that. There was a lot of debate around, should this be a charity, should this be a research project, should this be a company, what allows us to have the greatest flexibility to have the biggest impact. And yeah, after speaking with a few mentors, it was decided that a sort of a commercial endeavor allows you to pivot quickly and follow the directions that are going to be really specific to solve the customer's problems. So then we started the company last year, and I suppose the key pain points, that if we're honing in on the problem, all the people that we spoke to in terms of people with endometriosis, but also in the endometriosis community, from clinicians and endometriosis associations, and even in the health insurance sector, are kind of the key problems that people with endo face is they don't know about their condition or how to manage it, what their best management options are. They feel invalidated, alone and isolated on that journey to better symptom management. And as Joe mentioned, they can't afford or access this holistic care, which is guidelines based. There's emerging evidence that it's good for managing symptoms, but it just doesn't happen. It's hard to access alongside, we sort of see ourselves sitting alongside medical and surgical care. They're very important parts of endometriosis care, and we feel that, I guess, conservative holistic management options. And that led to the first version of Matilda, which was just basically a minimal viable product to validate that there's a need here and that there's some sort of solution product fit, and it's evolved since then.
Yeah, so I guess I could tell you why we're called Matilda as well, because that was something we talked about a lot last year, and we felt quite passionate about what our name would be. So we wanted the name to feel like a friend in your pocket. So something we really felt strongly about is that our kind of target audience is kind of anywhere. We break them into segments. So we've got the Tilly teen, the 12 to 18-year-old. Then we've got the 18 to 30-year-old, who we call Endo-Ella. And then we've got beyond 30, where we haven't quite worked out that market yet, but that kind of we think Endo-Ella spills a bit into that as you move into your 30s. We think maybe your symptoms might change a little bit, or your management might change a little bit. But what we wanted it to feel like someone on your team. So a friend that's there in your pocket, that's got your back, and kind of something I suppose a bit separate from you, that manages your endo. So that kind of separation of identity to chronic disease. So I suppose, going on from Freo Founders Startup Fest, we kind of really honed in on what our offering was going to be coming into 2023. So we wanted to allow users to, or people that use the platform, to be able to track their symptoms and lifestyle habits. So we know that endo warriors tend to advocate for themselves. So having some concrete data of what their symptoms look like to be able to go to their health professional. So for instance, when you're in the GP and you're in a rural setting, and we recognise the challenges of being a GP, that you've got to be kind of good at everything, which, I'm glad that's not me. So I'll much rather be a digital health founder. We also have to be good at everything in a different way. Yeah. But when you have to be good at everything, having someone come in and have a really clear, data about their symptoms and what they're doing and how they're managing is much easier to kind of, I understand, really recognise patterns and what's going on. and versus someone coming in and qualitatively telling you a bit about their health history and things like that. So, and on the back of that, also be able to educate the individual. So the individual then has a really good resource to kind of gain knowledge about, but also from a GP having that support to where they can actually refer people and say, hey, do you know what? I don't have all the answers about this, and that's okay, but I have a really great place to refer you to where there are a lot of answers. And I think the last piece of that is actually where that access to clinicians. So we've addressed that kind of, I don't understand my condition, I don't understand what helps, I don't know where to get information from, but then being able to put in place a team around that individual in that rural setting. So for rural patients, kind of saying, hey, let's place a team around you of not only clinicians, but also other endo warriors. So, you know, while it's 1 in 7 people have endo, that looks a bit different when you're in a rural setting where you might not feel like you know anyone or have anyone to talk to about what you're going through. So being able to create that network around the individual, but also that team of clinicians, that GP, you know, in the rural setting that says, hey, I know that you probably should see a physio, a dietitian, a naturopath and a psychologist, but where on earth am I going to find them? Well, that's where we come in and say, hey, we don't offer a one-to-one service as yet, because that's not affordable, or there's not enough clinicians still, so that's still a barrier. But where we've managed to address this problem is actually to say, hey, let's offer a group class setting. So as a physio, I run some of the group classes on Matilda, and that might be pelvic stretch, pelvic floor relaxation, education about what the pelvic floor is, education about how physio is important for endometriosis care, and replicating what I do in a one-to-one session at a class setting. So not only then do they get to connect with other endo warriors, but also with clinicians.
Yeah, and I suppose that that filters on into other health professionals that are on the platform in terms of providing these holistic classes. So we were speaking with a number of different health professionals, dietitians, for examples, naturopaths, exercise physiologists, to sort of provide that wraparound holistic care in that class schedule. And maybe it's worthwhile just summarising exactly what the platform is, so that's nice and clear. I suppose the first aspect is the tracking that Joe mentioned. So holistic tracking, or tracking of your symptoms, of your lifestyle factors, so that you can learn more about those relationships. We have big goals to make that, you know, machine learning and AI integrated, integrating with your wearable watch, so Apple Health and those sorts of things in the future, so that we can understand more about that individual and then help them provide, I guess, like a layer on top insights for that. It also allows us to do research, which is another big part of what we want to do. It's not only evidence-based, but also evidence-generating. So we've got good relationships with universities across Australia to help advance the knowledge into endometriosis. So that's the tracking feature. Then the next is learn, and that's those evidence-based learning modules, all about what endometriosis is, different health professionals, so they have that kind of baseline level of knowledge to help make those healthcare encounters with GPs in rural settings or other health professionals a bit, you know, they've got a baseline level of knowledge for that. The third aspect is community or connection. So whether that's through discussion groups or more of the classes, having peer-to-peer support, like accountability buddies, to help make sure that they know that they're not alone. And then finally is the classes. So turning all that information about endometriosis into action and providing that support for people to implement the important things that they've learned through that kind of lifestyle conservative management of their condition. And maybe, Joe, I don't know if you want to touch more on some of the, I don't know if tips is the right word, but for health professionals and rural GPs as well, in terms of, I think we did some research. We did some research at Curtin University with some master's students last year around what some of the missed opportunities were on that journey to diagnosis. And I suppose one of the key things Joe mentioned, self-advocacy. These people are constantly having to self-advocate for themselves, and they're not feeling believed by their health professionals. They're feeling like it's just dismissed, and invalidation's a really common theme that came up out of that. So I guess one aspect of that is providing that validation and saying, hey, look, this sounds like a really tough experience for you, and helping convey that those people are believed, and not dismissing intense episodes of pain as just normal period pain, I guess.
Yeah, I can probably talk a bit about that. So We, as Kev said, we did some research last year with some master students and highlighted, these common themes that keep coming up. And validation is definitely a big point. So validating all symptoms. So whether that be anything from fatigue or bladder or bowel dysfunction. The other thing I think was a big tip was actually, I don't know what I don't know. So recognising also that being a rural GP, you don't need to know all the things that they need you to know, because that is challenging. But actually being able to have places where you can send them and say, hey, and being really honest and transparent about that. I don't actually know. I know what endometriosis is, but I actually don't have the best idea of how to manage that. So either having people that you refer to and referring early, so that referral on to a specialist gynecologist who has the skill set to treat endometriosis, because that is a niche in gynecology, but also saying, look, I know that who should be on your care team, and that's who I can advocate for you to be referred to, or referring to platforms like Matilda, where you say, do you know what? Let's both learn together on this journey of how we're going to understand how best to look after you. Because like all chronic diseases, everyone's endometriosis also looks different. And so what they'll need will also look different, but understanding they'll need a care team early. So one of the missed opportunities was I didn't know that a physio could help me. I didn't know that a dietitian could help me until I'm 10 years into my journey. And then you think, then we're dealing with 10 years of symptoms. So that early symptom management, early team care, early team kind of management, and understanding that it is a really multifaceted disease, and so it does need a multifaceted team to manage it. Something I think that I wanted to highlight also probably about us is that we're clinically backed. So we're backed by a team of clinical experts in the field. So we've got 3 gynecologists who are AGES trained, so advanced scope trained in endometriosis, and treat almost exclusively endo in Perth, which is great. Also, we have a trauma-informed clin psych and a specialist physio. So both our clin psych and physio have PhDs. We've got a naturopath that is an endo that has endometriosis herself, so really understands that, and it's kind of paved the way for naturopathy in endometriosis care, in addition to a lived experience group. So something we feel really strongly about, and a dietitian who is experienced, also very experienced and has done extra training in women's health. So in addition to our lived experience groups, we've actually designed Matilda with people with endometriosis, meaning that we meet those end users' needs. So knowing that our platform has had that rigorous testing of people that have actually got endometriosis, so they're constantly in there telling us things that would be better on that platform. Other tips I would say from an early point of view is that if a patient lives rurally, doesn't mean a physio, say for instance in Perth, or a dietitian wouldn't see them online. So I think knowing that isn't a barrier. I have lots of patients rurally who I see via telehealth. So referring on or flicking an email and saying, hey, this is what I've got. What are your thoughts? And I think even from a gynecologist, knowing that telehealth has grown since COVID, and that actually that's a really good option, that lots of gynecologists will say, do you know what? Don't travel up to Perth for this consult. Let's have a consult online and actually put some steps in place so that they're not travelling all the time. Because one of the big other things that the research highlighted was this time off work concept. Time off work, the cost of endo, so $9.7 billion to the Australian economy every year. And during our customer interviews, anywhere from $1,000 to $15,000 a year. Out of pocket. So that could be on travel costs, medications, and consults. So you think we want to minimise that travel cost, because that's every appointment. We all work 9 to 5 or some variation of 9 to 5, and that these people with endo, that is that kind of having to travel during their work hours, and particularly in a rural setting, that's more time off than there needs to be. And I think the last point I'd actually add the last point from our research was gendered language. So we know that men can also have endo, although very rare. So there's been 30 cases, I think, in the research so far. But a real push in Matilda, we're very, one of our visions, or I suppose one of our values is inclusivity. And so we use non-gendered language at Matilda, so people with endometriosis or those assigned female at birth. And Endometriosis WA is very passionate about really pushing that. And that's, I think, really important that we recognise that as clinicians. And I try really hard in clinic to make sure we use that people with endometriosis. And I think we kind of, as we move forward in the future, that's really important.
Yeah, and just to touch on a couple further things, most of our referrals, or almost equal with sort of social media, Instagram, has been from health professionals. And as Joe mentioned, it's been co-designed with these endometriosis experts, but also evidence informed. We have references down the bottom of our education modules of where we get our information from. So yeah, it's kind of that full loop, and I kind of alluded to wanting to be evidence generating as well as evidence informed. So I still maintain a sessional academic role at Curtin. We've got really strong relationships with, for example, University of South Australia, University of Sydney, Western Sydney University, a number of different universities around Australia that really specialise in either pelvic pain or endometriosis research. So we want the platform, we're going through the ethics approval process at the moment, we want the platform to generate more new knowledge about endometriosis. If people are providing their data to help them understand it, we can collate that at a group level and really start to tease out these important relationships so that we can give back and learn more about endometriosis to help people even further, is one of our, I suppose, key visions at Matilda as well.
I could give some hot tips as well, being a GP, that maybe if you have someone walk in through your door, that maybe could be actually quite useful for in clinic as well. So we are quite passionate about outcome measures. So I know at the Pelvic Health Clinic that I work at in Perth, we offer kind of a suite of outcome measures when people come in. But I think we found at Matilda that's been really useful to highlight to people about how much they've improved. So even things as simple as how much fear do you have around your condition, or how much does your condition impact your daily life. So some validated quality of life outcome measures. The other one I think that is quite useful for a conversation is the CSI, the Central Sensitisation Inventory. Obviously, these individuals have often had a prolonged period of pain, that if they got their period at 12 and every period has been significant, that's a lot of painful episodes in addition to what might happen in between those periods. So we often will screen the Central Sensitisation Inventory not to use as a diagnostic tool, but more as a conversation opener of, hey, you might find that this highlights you need to address your whole nervous system with things like sleep and exercise and nourishment from diet and things like that. So that would be my first thing, is outcome measures and have your go-tos. My second thing would be really simple fixes. So things like wearable heat packs. So having your go-tos of like the Spoonie Society, the Happy Uterus are great places that have wearable heat packs, and TENS units. So we know that there's good evidence now about TENS units for dysmenorrhea or for period pain. So we often refer to places like TAP Health is one option, Overa is another option, and Vush is another option. So all really great wearable, discreet, and lightweight TENS units that people can stick under their clothes. Lots of people will talk about the little stick-on heat packs, so hotties, which are hand warmers that you can stick on to your skin, so they can be great as well. In addition to kind of meditation, mindfulness, things to really calm that nervous system down. So utilising, we have that on the Matilda platform, but also whether that's been kind of getting out and doing some mindfulness in nature and things like that. And otherwise, following Matilda, we offer on Instagram, we offer some really great educational content on Instagram. Something I never thought I'd say is look into social media for good quality information, but here I am, modern day, 2023. This is where we interviewed everyone where they get their information from, and social media was actually their number one, which does hurt my soul a little bit, but here I am at least recommending a platform that we feel passionate about, that on social media we release things that are really useful, and obviously that growing community and engaged community has been great for us.
Yeah, and maybe just to double click again on some of the important considerations, I think with endometriosis, like many health conditions, and certainly myself coming from a background in low back pain, one of the key messages for almost hope and recovery is that tissue damage or symptom severity tissue damage doesn't correlate with symptom severity. So people can have quite advanced endometriosis or quite advanced disease and have minimal symptoms, and people can have very minor disease and quite significant symptoms. So again, that kind of makes it more, in a sense, complex for us as health professionals to understand that, but really important to validate that whole experience and that whole journey for people, that tissue damage doesn't necessarily correlate with symptom severity or disease severity.
I want to probably start also acknowledge some organisations that do a little bit of work that can be really great resources to reach out to as well. So Endo WA, we're so lucky in WA to have Endo WA, and the team there, they do huge amounts of work. They're all volunteers, so they do endless amounts of work in the space for advocating and also educational. So they I know we've presented alongside them, but they also host educational events where they get health professionals in. So recently they had a panel where there was a physio, a dietitian, a psychologist and a gynecologist, which they also stream online. So lots of their events are online, so from a rural setting that's really good. There's other organisations as well, so the Australian Coalition for Endometriosis, which is kind of where all the state bodies kind of come together and have a voice as one, which is really great to see what they do in the space. And Pelvic Pain Australia, so they have a really great resource library where you can access, I use their stretchers all the time online. They've got a PDF of stretchers, which I print out to patients all the time because it's got 8 really basic stretchers on there that are really good for most pelvic pain conditions, but particularly endometriosis. But they also offer information about things like useful medications and what their role is in pelvic pain, and a full suite of kind of building out that care team and common themes that are happening with people with pelvic pain or endometriosis. So I think as a resource library, they can be really useful.
And Endo Australia as well, I guess. There's a number of organisations doing important work in this space.
Going forward with Matilda, what do we wish for? I think we're a young, growing business. We're just over a year old now. So we're looking for someone who's got kind of a greenfields, excited vision for building tech products, who wants to be part of a health startup that wants to make a bit of a difference to the world and how pelvic pain and endometriosis are managed in the world. Hopefully, so in 2024, I imagine it's going to be a big year for Matilda. We hope to have growing referrals, particularly from healthcare professionals. That's a real passion of ours, is to support healthcare professionals and to be able to provide a framework so that they feel they've got a really strong place to refer their patients. We know that healthcare professionals are always really passionate about good quality care. We hope for research, so like Kev has mentioned, being able to grow research. And really, I suppose, we're obsessed with the problem, obsessed with solving this problem and how we can use technology to solve this problem, to service people around the world. That, I can't believe I might say that Australia, we know we've got a good healthcare system in Australia, but it's a global problem, and there are healthcare systems around the world that this condition is even more underserviced than what we do. So you can download Matilda off the App Store. Our next platform will hopefully release in the next couple of weeks, but you can still download off the App Store. Reach out to us at hello@matilda.health if you want to hear from us or you want us to do any education. We're passionate about educating anyone that will listen to us. Or if you want any flyers in your clinic, we post flyers all the time to clinics. So let us do that hard work for you and put some flyers in your clinic of where people can get Matilda.
Back of the toilet door is a good place for the flyers.
Yeah, we love that.
And the website is www.matilda.health.